and then the whole crowd is from psychology background, I assume, and having from different background. I understand that there are students from undergraduation, and then there are also students from post graduation currently pursuing PhD, and also those who are currently working, isn't it? Can I have a quick description about your professional background, like not for UG and PG students? This I've done with UG and PG. Is there any practicing professionals here? Can kindly mention your designation or something, so that I'll try to bridge the gap. I should not be very low in level of understanding. Okay, school psychologist, assistant professor, very good. Okay, any practicing psychologist? Okay, school psychologist. Okay, it's quite a good number of school psychologists. Great. Oh, good. Very good. Okay, assistant professor. Okay. Oh, school counselor. Uh-huh. It's very interesting. Okay. Any other practicing professionals? Psychologist, private practice and student counselor, a psychologist in the addiction center. Okay, great. Okay. I feel more responsible now, right? Good. Is there any other professionals? Right. Fine. Great. So let me just switch into the session. So before me starting off with it, this is what the whole uh, content of the session would be. We'll be sticking around till 7:30, isn't it? I'll definitely try to be on time, and then we'll make it as fruitful as possible. Fine. So before me starting off with within the content, we just have to uh, draw a common boundary, isn't it? So I would like to understand your objectives of the session, or what would you want to take away from the session? What do you consider as an outcome of attending this particular workshop? There are around 90, more than 90 people in the workshop. Everybody will have some or the other objective, isn't it? Yes, you can put your objectives in the chat box, so that we'll run through any commonalities, and then I can address it simultaneously. Case conceptualization for CBT. Okay. Case conceptualization for CBT. Effective application of CBT approach in counseling. More learning about this therapy. Okay. We may not be discussing much about the case conceptualization. I'm very sorry about it. And then you can also find it as out of the content boundary, which I have mentioned in the table of contents as well. Okay. Effective application of CBT approaches in counseling. Yes. So here and there, I'll definitely make sure that I'll bridge between the knowledge and then the application aspect of it. Right. I'll also try to give you some sort of specific examples which we can use in the therapy, usual therapeutic approaches, which I generally use in my counseling sessions. Okay. More learning about techniques, particularly used in CBT. Okay, Saitobani. I'll be introducing you with the list of techniques. Right, we may not be going into the details of those techniques, which we have to discuss elaboratively in our extensive program. We'll be having our upcoming extensive intense training in cognitive behavior therapy, where we'll be discussing much in detail about the application of these techniques in detail. Right, but I'll just orient you and then let you know the broader varieties of techniques as well as the specific techniques. I'll try to give you some specific examples as well. How CBT will work in practical counseling setup. Very good question, Harshini, because there is again a greater myth which is in our profession, that CBT should not be used by counseling psychologists. I consider it as a strong myth which is revolving in specifically among clinical psychologists, and then that's also there in the profession as well. Right, to answer that particular myth, to break that particular myth, we need to understand. I'll give you a specific examples of this application of CBT in non-clinical setup. Right, even though cognitive behavior therapy has been originated to treat or intervene people with depression. Ehrenberg invented that particular therapy to treat particular condition, but that application or the basic principles of that particular therapy is it's wide, right? And then it can still be considered as a gold standard effective interventional treatment for non-clinical symptoms as well, non-clinical population, and specifically, I'll also ask you some more question following to this particular boundary issue, right? And how CBT works in practical counseling setup. Orient my students on CBT who are interested in practicing. Okay, right, fine. And that you will definitely get Neela Roman, ma'am. Fine. Okay, and then practicing professionals or who are working as a school psychologist. Can you tell me common issues that you guys are facing, or the frequent problem that you are encountering in your context? Yes, Vasant Kumari, you can drop your opinion, answer, or your responses in the chat box. The nature of clients that you are dealing with, or the most frequent kind of problem that you are dealing with. School counselors or practicing professionals or college students can also tell what kind of problem that you guys are currently going on. So that can also be considered under this issue, isn't it? Yes. What is the silence? Okay. Anxiety. Okay. Right. So whatever comes under subclinical level can be dealt by a counseling psychologist. Right. Subclinical level of anxiety. If in case an individual has anxiety disorder, it has to be referred to a clinical psychologist. That's what the boundary. Right. We need to strictly follow this particular boundary, as in understand. Clinical psychologists are the one who can deal with individual with mental illness, right? And then a psychologist or a counseling psychologist, school psychologist can deal with individuals having psychological problems, right? So that's what I'm expecting. What are all the common psychological problems that you are seeing? Okay, right. Anxiety, if as I mentioned, if it is subclinical level, it is at the level, it's at the scope of counseling psychologist. Again, social media addiction. So addiction is a term related to disorder, right? You can rather use overuse, right? Social media overuse is still under the scope of counseling psychologist, right? If in case again, if an individual has been diagnosed with addiction, a behavioral addiction, then it has to be again referred to a clinical psychologist. Understood? Difficulty in concentration, very good. Suicide prevention, yes. At the preventive level, definitely yes. But most often, preventive mechanisms would be predominantly dealt in a community level or the group-based setup where we have very less amount of CBT-related works. But again, there's a wide range of applications as well. Okay, peer relationship. Okay, depression. Okay, depression has to be referred to a clinical psychologist because depression is a type of mental illness, right? Okay, lack of emotional support by parents, over pampering, anger issues. Very good, Vedika ma'am. So difficulty in regulating anger would definitely be a pattern. And then we also consider parenting issues with parenting. Consider self-harm, okay, anger issues, good. Trauma, okay. If in case again, it's about the level of reaction. So for example, consider adjustmental problems, right? You can again find it in DSM in terms of adjustmental disorder, right? What differentiates adjustmental problem from adjustmental disorder? Because again, the scope of intervention of a clinical psychologist and a counseling psychologist, again a question here. Consider an individual is entering into a new environment, right? And he has difficulty in adjusting to the environment. Everybody will have experience in it. Everybody will have some sort of difficulty in adjusting to the environment. Yes. But what makes it as a disorder? If an individual has significant amount of anxiety, stress, or depressive reactions, even after 6 months, that makes him as being considered under having a adjustmental disorder, isn't it? But within that 6 months, it's still under the boundary of a counseling psychologist to intervene, right? Even though that we need to consider about the intensity of this reaction, right? Considering the intensity of the reaction, having this adjustmental problem can be dealt by a counseling psychologist. Again, consider grief. Everybody experiences grief, isn't it? After any perceived or significant loss, actual loss, every individual experiences grief reaction. It's a very common reaction. For someone, it can be very intense, right? But what makes it as complicated grief reaction? Again, the same symptoms, as in that preoccupation, longing, earning, or a low mood, right? Or not able to deal with the upcoming events. All those things, even after 6 months, would only be considered as a disorder. Within again 6 months, if the intensity of the reaction is less, still it can be dealt by a counseling psychologist, right? So that's what the boundary issue that we are certainly facing, and then that we need to have a high ethical standards, right? That's what we have to impart. We're not supposed to practice like it's fine. Nobody would going to see, or nobody going to know that I'm going to intervene. Kindly don't do it, right? We should have our own ethical values when it comes to practice, because we are going to be considered as professionals, right? I'm talking to students, right? So since like there are students and who are going to be an upcoming professionals, I'm just trying to give you much boundary factors, right? Fine. So again, depression, as I mentioned, displacement of anger, and then selective mutism. Again, I think even like I cannot intervene this. I'm not specifically trained, or whenever that we are confronted with this kind of conditions. And then imagine, consider myself. Like I got 2 years of training in NAMANS while doing my MPhil degree. Within that particular time, how many kinds of disorder that I would have treated or tried to treat? I wouldn't have treated at that time, but I would have tried to treat during my training, isn't it? How many numbers of disorders that I would have got trained? There are around more than 400 disorders according to ICD and DSM, isn't it? I wouldn't have definitely got trained in all those dealing with all those disorders. That's where comes the importance of supervision, right? Which is again lacking in our profession, right? So again, whenever that we are being confronted with any kind of difficulties or any new conditions, it is not necessary that you have to always refer. With your level of expertise, you can continue with that particular condition, provided having a supervision, right? And then OCD, again, it's a disorder which has to be treated under a clinical condition. And then predominant scope of this session would be under the non-clinical setup, right? That I'm trying to again make the boundary. For example, consider stress management, which is a very fundamental factor which everybody goes through, and then application of CBT is on stress management as well, right? And then anger regulation, and then the very broader scope of work that is still there in the relationship side. Nobody has spoke about it, right? Like marriage counseling or couple counseling is a very wide area which we can intervene. Like there are a lot of CBT approaches which would be effective in dealing with relationship issues, or even at an interpersonal relationship issues, right? Which CBT predominantly focus on skills training as well, right? So considering interpersonal relationship as a skill, it would be definitely contribute or be helpful in that domain as well. Again, PTSD, again, it is that's what I mentioned about trauma, right? The intensity of the trauma is very, very important. And then how long the individual is going through this particular condition, that is also very much essential, right? In order to understand. whenever that you consider any individuals having PTSD, it is again has to be referred to a clinical psychologist, because it is the expansion of PTSD itself is a disorder, isn't it? Post-traumatic stress disorder, right? It's a clinical condition. Okay, de-addiction setups, yes. Again, there are a lot of social workers who are still working with de-addiction people or individuals having addictions, and then they're still using cognitive behavior therapy. And then when I look from a broader perspective, so I also assume that there are few social workers in this session, right? There are very few social workers. To understand the broader boundary issues, again addressing there particularly, according to National Allied Commission on Healthcare Professionals, that it has published in 2021, according to which both psychologists, school psychologists, social workers, medical counselors, everybody comes under behavioral health science department, right? We all comes under a umbrella term called behavioral health sciences, right? Provided with the set of applications, and then the nature of population, and the nature of work, which has also been mentioned there. According to that, like people in de-addiction center can also use CBT and then cognitive or emotion specific techniques to intervene people having emotional and psychological problems, not again with disorders, right? But provided having a very limited amount of experts or professionals in the field, a lot of social workers are still working in a de-addictive setup. You can definitely work with them under a supervision of a psychiatric social worker or clinical psychologist, right? Just try to take those supervisions as well, right? And then so for CBT for addiction is one of the very important area. For example, there is a thing called relapse prevention based CBT approaches, right? They're not focusing on the breaking of this addiction, or not just focusing on the lapses. They're also targeting the relapse. So that's what the very recent approaches in the CBT, which has been focusing on this addiction related perspective, right? I understand that we have broadly made a forum, and then the issue, and then as I also mentioned earlier, we'll not be talking about the techniques more in detail, and then I'll try to introduce you with the set of techniques. There are a wide amount of techniques. I hope everybody would have got to know it, but I have organized it in a way which will make more sense to you. That's how I have organized it. Fine. So I'll try to spend less time in the historical aspect, and then my more focus will be on the generic model, right? That's what the most significant factor that I assume that I should pass on to the audience, right? And then we'll also briefly discuss about the cognitive distortions, right? Okay. While giving you the broader overview about cognitive behavior therapy, we consider it as a set of psychotherapy intervention, right? Which specifically talks about the relationship between thoughts, emotions, and behavior, right? Even though that we target all these things, we target on emotions, we target on thoughts, and we also target on behavior. But why would we call it as cognitive behavior therapy? From the name itself, the significance are given more to the cognitive aspects, isn't it? So that's what the second sentence stands for. Specifically, we're going to target, or they assume the fact that negative thought patterns, right? So that's what the core of most of our emotional distress and also a resultant of our maladaptive behavior, right? With that context, we consider it as cognitive behavior therapy, because we consider negative patterns plays a very important role. And then most of our techniques would again be targeting the negative patterns at the first level. And then we again obviously have techniques to address emotions and also the maladaptive behaviors also, right? So since it's an integration of all those factors, we have different sets of techniques to be intervened, right? So looking into the historical aspect of general psychotherapy, so as we all understand that the first form of therapeutic intervention, yes, can someone else kindly turn on the video? Yes. So you can guys go and cycle also. It's not necessary for few one or two to keep the video on throughout. right? So it'll be more motivating for me also. I'll also kind of get a kind of response or some reactions from your end, which would again motivate me to be more lively. Otherwise, I'll also be very dull, and then it's more of a reciprocal responses. Should I protest to to make people with on the video? Huh? Okay, I'll count five. On a count of five, that's all on the video. 1, 2, 3, 4. No one. So sad, man. Fine then. I'll be less motivated and teach you. Okay. Considering the historical aspect of psychotherapy, right? So for the first and foremost kind of intervention, or the first person to got an idea of that we can intervene people having mental illness through talking means was invented by Sigmund Freud. Was the first person who got this particular idea and evolved, had come up with a lot of abstract concepts. Right, I literally mean it is abstract concepts, because most of the concepts are very experiential in nature, which cannot be concretely explained. Right. For example, defense mechanisms. Everybody uses defense mechanism, but we cannot literally define it or do or any objectively measure it, right? And then consider about the catharsis. It's a common process which everybody goes through, which is again a very abstract in nature. The structure of mind, levels of consciousness, most of which are very abstract, right? And then even the techniques, free association technique, or slip of the tongue, or consider it as the dream analysis, most of which are again very abstract in nature, which lacks very scientific intervention. And then came up the second school of second wave, or considering the importance of behaviorism, came up with John B. Watson, and then there are a few more influential people, like we have Skinner, isn't it? And then Ivan Pavlov, and then about who's that? Modeling, Bandura, right? Albert Bandura. Most of them have given a lot of techniques within this behaviorism, and then again within behaviorism, we have set of techniques called systematic desensitization, and then exposure-related techniques, and then we have shaping, chaining, aversion-related techniques. A lot of techniques which can be still used in subclinical population or non-clinical population, and then coming to a cognitive behaviorism. And then considering about this cognitive school of psychology, Aaron Beck was not the first person to got this idea. Rather, we have Albert Ellis, right? So Albert Ellis has come up with a cognitive therapy, first form of cognitive therapy called rational emotive behavior therapy, right? REBT, which is a kind of more strict approach. Right. What differentiates REBT from CBT is this is the confrontative approach. Right. REBT took a very confrontative approach. Right. It'll the techniques itself will be very harsh. Right, on the face, as in countering the ideas on the face, or providing or considered as a devil's advocate. That again comes under rational emotive behavior therapy. Right. A lot of techniques which is very it's not a very subtle form of cognitive therapy, where Aaron Beck came up with a very subtle form or collaborative form of approach called cognitive behavior therapy. That's why we consider it as collaborative empiricism. Fundamental distinctive factor, or a primary factor when it comes to cognitive behaviorism of Aaron Beck is this empirical. Sorry, what is that? What empiricism? Collaborative empiricism. Right, both client and the therapist will have a equal power, right? Where they need to put an equal effort in order to achieve the goal, right? And it's also based on empirical evidences. It's an evidence-based practice, right? And then there are also a few other forms of cognitive therapies. For example, we have cognitive behavior modification, right? By Meckenbaum, cognitive behavior modification, right? Which is again comes under school of cognitive behavior therapy, right? Cognitive therapy and then cognitive behavior therapy, and then whatever that we are going to discuss today is going to be within the purview of Aaron Beck, right? Cognitive behavior approach. And then came up, Kabat-Zinn has come up with another important approach called mindfulness and acceptance based cognitive behavior therapy. And then most of the current practitioners would obviously integrate this mindfulness and acceptance based cognitive behavior therapy. So again, the fundamental difference between cognitive behaviorism or cognitive therapies and then this mindfulness and acceptance based cognitive therapy is predominantly sticks on the process, right? It predominantly talks about the values which has to be integrated during the process of change, right? For example, most of the time they focus on this awareness when it comes to mindfulness, and then the third wave psychotherapies, cognitive behavior therapy, most of the time they focus on or stick on the awareness, right? And also they'll again focus on the acceptance factor, right? Once we started accepting the limitations, whatever an individual is going through, the process of change would be slightly lesser difficult, like it will be relatively less difficult in nature. That's how this particular therapy came up with. And then you just consider the list of psychotherapies under this mindfulness. We have mindfulness based cognitive therapy as one set of therapy, and then we have acceptance and commitment therapy, right? And then we also have dialectic behavior therapy, right? A lot of therapies comes under this mindfulness and acceptance based cognitive therapy, which is again being considered to be one of the contemporary practices. I predominantly stick with cognitive approaches integrated with mindful practices, right? And then there's again a new set of therapies which has been evolving, and then currently under significant research is this integrative and multi-systemic approaches, right? I'll briefly take a moment to explain this integrative and multi-systemic approaches, since it is new to most of us. So it's most of an integration of this neuroscience and then cognitive practices, as well as this mindfulness and acceptance based practices. Like it's most of a holistic kind of approach. And then they work with a theory called, one particular set of researchers has been working with the theory called polyvagal theory. Polyvagal theory. So there's a nervous system, and then we also have vagus nerve, isn't it? So it's more of a neuroscience perspective. That's what they're mentioning. And then predominantly, we need to stick with the physiological aspects, right? Rather than regulating just the way of regulating emotions, we are informing the client in order to regulate this system itself, right? The parasympathetic nervous system itself, and then the sympathetic nervous system. They mentioned that there are two different sets of parasympathetic nervous system, right? Called ventral vagal system and then dorsal vagal system, right? Where they mentioned ventral vagal system supports the activation, as in imagine that for me the ventral vagal system is activated, right? In resultant, I'll be responding very appropriately to the social environment. I'll be very relaxed. I'll be engaging in social conversation, right? I'll be in a more relaxed and then in the normal state. As in the same time that we also have a dorsal vagal system, right? So the activation of dorsal vagal system will result in the freeze or shutdown responses, right? So we need to reduce the activation of that dorsal vagal system. And then about the sympathetic nervous system. And then we all understand that the sympathetic nervous system plays a huge role in the stress reaction, isn't it? Or in times of anxiety. Whenever that we have been given with the fight or flight response, or given with the stimulus which provokes fight or flight response, obviously our sympathetic nervous system would get activated, isn't it? And then they also use cognitive, behavioral, mindfulness, and acceptance-based techniques to regulate these vagal systems. That's what this polyvagal theory of practices based practices comes into this multi-systemic approaches. So apart from that, there are other few approaches as well, and we are not going into the details of it since it's not the focus of our session. Yes. Coming to the core of the workshop, right? So consider this is one of the important part of the workshop. I imagine that this is what the important part, right? So we consider it as cognitive behavior therapy. And then, as I also mentioned at the first, that we'll be whenever that cognitive behavior therapy deals with the relationship among cognition or thinking pattern, behavior, and also the emotional aspect. And also, I stress the fact that we place cognition at the top level, right? We understand irrational thinking pattern or negative thinking pattern would result in the dysregulated or difficult emotion, negative emotional experiences or maladaptive behavioral responses, isn't it? So thought causes negative emotions and negative behavior. That's how we broadly understand, right? So how do we get thought? It is based on the situation, right? So we can just look at this particular part of the slide. Yes, I'm trying to explain this one. Right, this was the fundamental aspect. So whenever and then again, when it comes to ABC, we consider antecedent, behavior, and then the consequences, isn't it? Right. Consider a situation or an event, whatever it could be. Even though it is physically same for most of the people, for individual experiences can be completely different from one another because of the way in which they perceive, isn't it? Whenever that the way we consider about perception, it has a huge influence of cognition because perception itself is a higher order cognitive process, isn't it? So it involves our knowledges, our previous experiences, most of which would definitely, or our emotions, most of which would definitely color our perception, right? So even though the situation is physically same for all, but at an individual level, the same situation can be different for different people, right? Which evokes individualized negative emotions or automatic thoughts about the situation, right? A same situation can provoke different thoughts to different individuals. Based on that particular kind of thought, an individual will be responding to the environment, right? So that's what this fundamental model that it is talking about. That's why that's what the thing that the irrational or negative thoughts leads to the difficult emotional experiences and also the maladaptive behavioral responses. That's what this particular picture talks about. And then coming to the level of control. So you consider that we have three different elements or four different elements of cognition, right? Yes. Just look into this. This is what we primarily call this generic cognitive model, right? This is what the cognitive generic cognitive model, behavior therapy model is this. So again, we usually talk about four different elements. That's again another important element which I will talk at the last. So we have at the first level we have our thoughts, and then there are different levels of thoughts which I'll definitely elaborate in the upcoming slides. And then another thing is about affect. As affect is nothing but the emotional reactions. And then we have behavior, and last we have physiological responses. And then you can also see it's all bidirectional in nature, right? It all can influence each other. First and foremost, taking it as a form of workshop, right? It is very essential for us to explain this to your client, right? Before we explain to our client, it is again important for us to understand this first. And I hope it's a very easy level of understanding which we can make, because it's a very simple approach. It doesn't involve any neuroscience or doesn't involve any atomic particle level knowledge, right? So it's a very fundamental aspect. At any point of time, an individual experiences can be broken down into four different elements, right? At any point of time, an individual experiences. Imagine that you're sitting here. If you introspect on your own self, you can dissect your experiences into these four elements. That's what we need to understand, right? Fine. We have thoughts as one element, and then emotion as another element, and then behavior as another element, and then physiological responses as another element, right? And then we also need to understand it all shares a relationship as bidirectional in nature, right? It reciprocally responsible. Fine. So as I mentioned earlier, this we have to explain it to our clients, isn't it? Right. So how would we explain? I usually explain with some examples, so that we need to make them understand that the thought comes first, and then we feel or react or behave, isn't it? That has to be established, isn't it? Fine. I generally give this particular example of a person who is coming back from a midnight show, right? He's walking back to his home in a dark road, and there's a light which is at the far, and then he can suddenly see a person who's running towards him. That's what the situation which has been given with, right? And then I generally ask them, what would you feel at this time? What would they generally tell is that they feel fearful or they'll feel anxious, they feel afraid, right? Since it is a night and then someone is running towards them. And then after some time, once as the person approaches closer, and then he would recognize that it is his friend, and then he is smiling and then laughing and then running at him. What would be the emotion now? They'll feel relaxed, they'll feel excited, right? What differences this particular event made? We had two different emotional responses and then behavioral responses. What differentiated one from another is about the thought or the interpretation what we made in the event about the event, isn't it? The event itself changed, but again, our perception towards the event is the fundamental key difference between these two resultant emotions and also the behavioral response, right? So in this way that you obviously people can come up with a lot of their own examples, right? But broadly, this is what the idea that we have to make. Fine. And then when it comes again coming to the competence of this in emotional experience or an individual experiences, this pointer I just forgot to mention. I mentioned that I'll be mentioning about the fifth element, which is again very important, isn't it? So all these elements, all those four elements operates within an individual's environment, right? So the same kind of understanding cannot be applicable to another individual from another situation who's coming from another set of situation. So it all happens within an individual's environment, their own personal historical aspects or the social context or where he is actually from. All those components has to be considered within this generic formulation, right? So that's what the point that I just based on it. Like, again, considering about the different levels of elements, that we have four different elements, isn't it? That we have behavior, physiology, cognition, and emotion. Which one is very easy to control? If you just try to arrange it in an ascending order, which one is very easy to control? Which among the four is very easy to control? Thought, emotion, behavior. Very good, ma'am. Behavior. Yes. Behavior can be controlled at any point of time immediately. Provided an individual has excessive impulsivity, they may have difficulty in inhibiting their responses. But most of the time, when it is relative to all those factors, behavior is the immediate control which one person can make, right? But at the same time, the effectiveness of that technique or the effectiveness or longevity of that inhibition will be relatively less, right? So if you just change an individual's behavior, the prolonged the time span that he may not engage in a behavior or he get out of it behavior, it will be very less, right? I hope I made sense. And then at second level of control, we have thoughts, right? So again, consider it is very relative in nature. Most of that at any point of time, automatic thoughts cannot be controlled at all, right? But as I mentioned, when it is relative, to thought when it comes to the comparison between emotion and cognition. Cognitions are relatively easy to regulate. We cannot control it, but we can try to regulate our thoughts or deal with it. But again, when it comes to emotion, it is one of the very difficult thing to regulate and also to control. And then relatively, obviously, everybody regulates their own emotions. It's not a very huge task, but considering the differences among this level of control, emotions stands at the third level, and then comes the physiology. Most of the time, emotions and physiology can be considered one another, because as we need to understand about the theories of emotion. It is again very fundamental to. It is very important to be thorough with our fundamentals. Right. So that's what the second point. So when it comes to the levels of control, behavior stands at the first level, cognition starts at the second level, and then comes the emotion, and then comes the physiological responses. Right. But still we have techniques to intervene at all these four elements. Right. For example, we have relaxation techniques, which would specifically target this physiological responses. Even though we consider it under behavioral technique, it predominantly focuses us on our regulating our physiological responses, isn't it? Fine. And then second pointer about the emotional aspects, and then considering about the contemporary theory or the recent understanding towards emotion. So what are the general theories that you guys are aware of when it comes to emotion? How do we conceptualize it? Because we conceptualize or we understand any concept through its theories, isn't it? Very good. Very good, Rajalakshmi ma'am. We have James Lang's theory as a first primitive theory, first one to come and first one to fail also. It has been proven wrong. Yes, very good. And then we have Cannon-Bard theory. Very good. Very good. It's coming in an order now. Good. And then we have Schachter-Singer two-factor theory, where he consider an individual's emotional expressions as well as the context plays, both the factors plays a significant role in understanding and deciding an emotional experience, is what Schachter spoke about. But when it comes to Lazarus, that is not two-factor theory, it is a single-factor theory called cognitive theory, right? So cognitive appraisal theory is what Lazarus theory is. So according to Lazarus, our interpretation just alone is enough for us to understand what emotion that we are experiencing. Right. So that's how, again, you can link it with this particular CBT. So according to Lazarus, an individual's interpretation or appraisal towards the event alone plays a significant role in deciding their emotional experience. Right? There are two fundamental factors in emotion: emotional expression and emotional experience. When it comes to emotional expressions, it is about physiological responses and then the automatic behavioral responses. For example, in case that you are hearing a loud noise, what would we do? We would feel shocked, isn't it? Without our immediate control, we give some startled responses, blinking or something, which is that's what we call it as emotional expressions. And then we may experience increased heartbeat. All these things happens automatically at the first level, and then we feel what experiences that we are having. That's what we call it as emotional experiences. But according to this Lazarus, he considered emotional expressions plays a very less role, but our cognitive appraisal or the interpretation towards the event alone plays a significant role, right, in deciding our emotion. Yes. And I should also talk about facial feedback hypothesis, as again it supports with James Lang hypothesis. When it comes to contemporary understanding, have you guys heard of psychoevolutionary theory of emotion? Psychoevolutionary theory of emotion. Yes. Robert Plutchik. Okay. I'll just quickly introduce you with that particular theory. It's a very interesting theory to know. Yes. I hope you must have seen this wheel of emotion. Yes. So according to Robert Plutchik, he considered that there are around, so we are still on till 7 p.m. Is it? Isn't it? The session is till 7 p.m. Okay. So we may Right. According to this particular theory, he considers that there are 8 primary emotions, right? There are 8 primary emotions, and then it has been grouped into 4 pairs, which is paired according to its polarity. Polarity means oppositeness, right? Joy is opposite of sadness, trust is opposite of disgust, fear is opposite of anger, and so on, right? So 8 different primary emotions has been divided into 2 different polarities, right? And then he also made it as 3-dimensional because he considered it under the levels, as in the intensity of the emotion also plays a significant role. For example, joyness can present at 3 different levels: happy, joy, elated, or bliss. Isn't it that there are multi levels in the same spectrum of emotion? And then this is very important. As I just mentioned about 8 primary emotions, he also spoke about compound emotions. Right, compound emotions is nothing but the combinations of these primary emotions. Right, for example, we have joy and trust. If these 2 things combines, we experience love. Right, so that's how we generally considers that there are multiple emotions within one specific individual. Yes. And then the last part of the discussion before we moving on. Just a minute. I think we have techniques at the next level. Okay. We may not be able to discuss about cognitive distortions, but I'll just introduce you with the techniques. Yes. So, briefing about the levels of thoughts that we have. As we have been mentioning, that we will be predominantly focusing on the negative thoughts or negative patterns of thinking, isn't it? That's what we have been talking from the initial. But at the thought level, that there are 3 different levels of thoughts, right? So first, at the foreground, what we experience is automatic negative thought, which will be very situation specific, right? And at the same time, it has to be automatic in nature. And then what makes it negative? It's not about the content of the thought, rather it is about the outcome outcome of the particular thought. I'll give you an example. Imagine that you are sitting in a auditorium where your one of the classmates whom you hate the most is going to get an award, right? Suddenly we get a image of him dripping in or falling in the big podium, right in front of everyone. He falls down and then gets embarrassed, and then we suddenly get a laugh or smile at our face, and then we come back to the normal. So this is one kind of image that you are getting, right? Would you consider it as a negative thought or a positive thought? What would you consider it as? The thought of your friend falling. Okay, negative. Yes, to bus. Talking from a very moral perspective, isn't it? How can I have this kind of thought? It's very bad to think of someone falling like that, isn't it? Okay. Let us not look from a moral perspective here, because we are not talking about right thought or wrong thought. It is about positive thought or negative thought. As I also mentioned earlier, it is about the consequences of that thought. What are we getting? Like immediately after getting that particular thought, we had a smile at our face, isn't it? We felt happy having that particular thought. Felt some sort of satisfaction, isn't it? Right? So that makes that particular thought as positive, not negative. What makes particular thought as negative is the negative emotional consequences. For the same people who have high level of moral standards can still feel negative about this thought. As I mentioned then, okay, it is not morally right for me to have this thought at this time. How can he feel this way? I'm a very bad person to have this thought like this. He really deserved. I just that I don't like him. how can I think that he can fall? From a moral perspective, an individual has a very high level of moral standards. He may have difficulty in accepting this thought, or he can make it as negative. But for most of the people, and then specifically for me and all, I will enjoy at that time. I'll feel happy if I'll experience this momentary happiness, and then I'll just get back to the event. Right. So that's what the typical nature of this negative automatic thought. It comes automatically without our volition, without our control, or without our motivation. It just comes, right? And then it makes us feel negative, right? Negative as in distress emotions, right? At the second level, we have intermediate beliefs, and at the third level, we have core beliefs, right? And then they consider the core belief has been obtained through a early negative experiences, or any early experiences will contribute to the development of this core belief. Again, lot of core beliefs makes us form our sense of self, right? And I hope everybody must have seen Inside Out movie. If not, I would strongly recommend you guys to watch that. Maybe after understanding these elements, it'll be very great, and then it may improve your level of perception towards the movie, I guess, right? The formation of core beliefs, and then the formation of sense of self, the role of emotions, and then the function of memory. A lot of factors has been discussed very elaboratively in that movie. I'll try to view that movie, right? Fine. And we may not be able to discuss cognitive distortion much in detail, right? I would wanted to take a moment to stress on the importance of techniques. I just needed 5 minutes, but since we are rushing up for a more till time, that I'll just quickly mention the significance. You understand the impact of it, right? So having knowledge and having technique, both are very, very important, right? Imagine yourself standing in front of a satellite, and then imagine you're an astronaut, and then you're standing in front of a satellite, and then you have a lot of knowledge, but you don't have any tools, but you are supposed to repair the aircraft. It is not at all possible. The toolbox is what the techniques that we have. It provided whatever that the knowledge that we have, and having the skills and techniques is very, very fundamental, right? And then the difference between skill and technique is again has to be differentiated. Skill is predominantly focuses on the process orientation, but the techniques will be used for an outcome orientation. There will be a specific outcome for which that you will be applying a specific technique on. I'll give you an example. Systematic desensitization is used to reduce anxiety or fear response, right? And then listening is a skill. What is it used for? It is used for the process, right? Or empathy, or rephrasing, or paraphrasing. All those things are skills which will be used to do the therapy. But systematic desensitization, shaping, cognitive restructuring, downward arrowing are the techniques which are used to achieve some specific outcome. That's what the difference is between the technique as well as the skill. Yes. And then to broadly summarize the different types of techniques which is in cognitive behavior therapy, which again can be broadly categorized into 3 different levels. I have also included techniques from mindfulness-based work, which is not a component of typical cognitive behavior therapy. But as I mentioned, for the real-life practice, it will be very good if we integrate mindfulness and then acceptance-based practices as well, right? Fine. And then when it comes to cognitive-focused therapy, for cognition-focused techniques, the primary focus is to change the thought patterns or the belief levels, as I mentioned, at the 3 different levels: automatic thoughts, core beliefs, and also we have intermediate beliefs, isn't it? We have sets of techniques to intervene at all levels. We have techniques to intervene at automatic negative thought level, or at an intermediate level, or at the core beliefs level, right? Based on the intensity of the issue, that we will choose which one to target on, right? And then we have a set of behavioral techniques, which is again very action-oriented, targets a specific maladaptive behavior or a problematic behavior, right? And last we have third wave techniques, as I mentioned about the integration of this acceptance and mindfulness-based practices, right? Looking to the specific techniques within the specific domains, right? Under cognitive behavior therapy, we have set of techniques like cognitive restructuring, Socratic questioning, thought record, and downward arrowing, right? This downward arrowing can again be called as vertical descent, right? I'll give you an example. Imagine a person has a very low self-esteem, right? And then he may have a core belief like I'm useless or I'm incompetent, which will again be reflecting on most of this pervasively in most of his real life scenarios, right? In order to elicit his core beliefs, we just start with this automatic negative thought, whatever that he experiences. And slowly we'll ask further questions in order to elicit the core beliefs that he has, right? So that's what we call it as this downward arrowing technique. Right, under again Socratic questioning, there are around 6 different types of Socratic questioning, right, which we have. Under behavioral technique, we have around set of techniques called behavioral activation. Behavioral activation can be provided as a standalone therapy for people having depression, right? But again, for subclinical population or non-clinical setup also, we can still have behavioral activation. Those who have low motivation, or imagine an individual has procrastination, right? For people having procrastination, we can obviously use this activity scheduling technique, right? And then for imagine that for stress management, we have a relaxation technique. Again, under relaxation technique, there are again like lot of sets of relaxation technique. For example, you have Jacobson's progressive muscular relaxation, and then we have autogenic training, and then we have applied relaxation, and then we have body scan meditation, right, and so on. There are a lot of other relaxation techniques also, right? And then again, problem solving therapy or problem solving technique can again be provided as a standalone therapy itself, right? There's a set of procedure for around 4 or 5 sessions. We have a set protocol which can be followed to do this problem solving therapy. And then it is again be a very effective when it comes to relationship counseling, right? And then again, when it comes to third wave integrated therapeutic techniques, we have mindfulness based integrations. Again, under mindfulness, there are again a lot of techniques. I just mentioned about the headings. For example, as I mentioned about body scan, or we can practice grounding techniques, or being it as a breathing space, right? Or mindful eating, or mindful at all sensory level that we have, right? And then we have acceptance based, and then dialectical behavior therapy. Yes. And then specifically when it comes to dialectical behavior therapy, there are 4 primary components, right? They specifically focus on skill building, and then they talk about 4 specific skills necessarily. For example, they talk about mindfulness skills, and then emotion regulation as a skill, distress tolerance as another skill, and interpersonal effectiveness as other skill, right? If you try to understand the workbook or the materials, there are a lot of techniques, specific techniques which is under dialectical behavior therapy. As I mentioned about 4 different components, there are again set of techniques under each components that they're in detail, right? So I've again already taken much time, like I'm already 5 minutes late, so sorry. Yes, any questions or comments that I can take? I'll address it for 10 minutes. Any doubts? It'll be useful for others as well. Did I keep my words? Yes. Thank you for the wonderful outline. Okay, thank you. How to identify dysfunctional thoughts? Right. Very good. As I mentioned earlier, when it comes to cognitive restructuring, we have different sets of techniques. At first and foremost, as I mentioned about the dysfunctional thoughts, we discuss it in three different levels. We have automatic negative thought, and then we have mm, intermediate beliefs, and also the core beliefs. For example, that I'll just take up one technique through which we can identify this dysfunctional beliefs. One easy technique is this thought diary, right? Using thought journal is one of the fundamental technique we can suggest. Otherwise, when it comes to the therapy, we can use role play, or we can use reliving experiences, or we can use imagination techniques, right? Visualization techniques, as in we can ask the individual to imagine. For example, consider that the individual has difficulty in speaking in public places, or talking in a crowd, or he deals a lot of anxiety, right? We can ask an individual to imagine himself standing in front of a crowd, and then we can ask them what is running in their mind, right? Through which we can identify dysfunctional thoughts. That's what, like, again, we have to, I have to mention about the specific techniques. It will CBT work for all groups? Okay, right. For consider for children's predominantly expressive related works are preferably given, and then at the second level we also stick with behavioral techniques when it comes to children's, right? Behavioral management is what the first level of preferences that we can provide. And then for adults and all, and also for geriatric populations, CBT has been proven effective across ages, right? And then obviously there are cognitive behavior therapy based play techniques also. But most of the time, play and expressive related works is preferable for children, and also behavioral techniques. And then at the other stages that we can provide with other techniques. Specifically, less educated, sometimes they find difficult to following. For them, it is preferably behavior therapy. Hygiene. Yes. Okay. And at the end, I'll also be briefing you about the upcoming intensive training program, which will be launching in the next month. This is again on cognitive behavior therapy. Those who are interested can stay back and listen to that orientation. It will be just before 5 minutes. Will CBT work in group counseling? Yes, yes, Romana. There are principles for group counseling as well. Okay, sir. Thank you. Any other doubts? Okay. Right. So we'll try to send the feedback form to you all, and then I request you to kindly fill it and send it. We'll post it in the what is that? In the WhatsApp group, right? So before we winding up with the session, let me just briefly orient you about the upcoming intense training program that we have on cognitive behavior therapy. So this is particularly to equip the students to become a practitioners, right? And then I don't blame the education system. I've been working as a assistant professor and also heading the department. I've been working as an assistant professor for last 5 years, and also been a HOD in charge. Is the presentation visible? Yes. HOD in charge for around 2.5 years or so, around 2.5 years to 3 years. I acknowledge the fact that the academic setup has a limitation of equipping individual as a psychologist. We are producing psychology graduates, but I'm significantly doubtful that we are actually producing psychologists. And consider myself, immediately after post-graduation, I was not at all ready to become a practitioner or to practice independently. And that's why I mentioned that the lack. And then within the boundary of an academic setup, whatever they equip, whatever that they can equip, people are trying to equip is what I'm mentioning. I'm not playing safe. Considering from that particular background where I belong, I'm acknowledging the fact, and also mentioning the limitation within the system that we have. So this particular workshop will be intensive training. It's not a workshop. Okay, I presented a wrong one. Just a minute. Yes. Okay. I hope it is visible. Yeah. Right. So provided the fact that to bridge or to make the professionals or the participants to become professionals at that initial level, we have come up with this particular program, right? Where I'll just tell you the course overview. Yes. So the general duration of the course would be for 12 weeks, right? And then within that 12 weeks, we'll be having 8 hours of lecture session, number of lecture sessions, which ranges between 1.5 hours to 2 hours, right? And then we'll be having two different assignments, but at the same time, we'll be having one session purely dedicated to discuss about the assignments. And then even in the lecture sessions, whenever it is important, we will be integrating role play. But again, on the roster basis, we'll have two different sessions dedicated specifically for role play, right? So that we can understand and apply the techniques, whatever that we have been learning throughout the course. As I spoke about all those techniques, acceptance and commitment based, or being it is a behavioral activation, or activity scheduling, Socratic questioning, systematic desensitization, and whatnot. Right, most of the techniques, whatever that we will be discussing, would be conducted in a role play format, and then we'll also have one session on a case discussion, right, where we'll start with the introduction or a case summary, and then end up with the termination process, like what really generally happened in the whole thing. And then during the usual lecture sessions, also we'll be taking up and giving you with different case examples, but we again have a dedicated case discussion forum, right? That's again a general practice, which is usually been practiced in an esteemed institutions. So we are trying to integrate that as well. Right, and then the assignments will be on the topic, like topic presentation, and then we would be asking you to make some video presentations, and then administrating necessary psychological assessments. And then because usage of psychological assessments is again an integral part of professional practice, which most of us would not stick with, right? We will discuss about those importance of assessments, the availabilities of assessments more in detail in the sessions, right? And then case formulations or case conceptualization, again, a very important and integral element of the whole process. And then it is not a one-time thing. Rather, the case formulation is a dynamic process, right? We have to formulate as and when we get new sets of informations. And then the role play. These are all the assignments that we will be having. And then very unique point for this for our from our institutions is about this 10 sessions of free case supervisions, right? Once you are done with our courses, right? Imagine that you have done with 12 lectures and then submitted all the assignments and also attended the 5 courses. And even after terminating the particular courses, you will be having 10 free case supervisions with our consultants, as in every case discussion would length between 30 minutes, right? Would be for 30 minutes, where you can discuss about your clients, whatever the concerns that you have, that you can consider, you can consult and then get supervision from our professional and qualified professionals, right? So that's the one unique point. And then this is because that we have introduced to bridge a very primary gap that we have in general professional practice, right? Because most of the students or trainees who have attended this would have learned things, but after which they'll have difficulty in applying it, and then while actually applying those skills only or those techniques only, they really feel what the little difficulties that they can address, right? With that, to address, to just bridge that particular gap, they come up with it. And then this is what the syllabus of our training would be. Right? We have mentioned about this orientation, historical aspects, and then the theoretical aspects very briefly, and then at a very 2x speed. In those sessions or in the intensive training program, we'll be discussing each and everything in very detail, and then understand that all those lectures are not recorded lectures, which would be in a live sessions. Like all those sessions will be conducted in a live setup, and then I don't want to read all these things. Will be look at those things. Yes, as ma'am asked for to identify dysfunctional thoughts, isn't it? So we have two sets of techniques which can be spread over for two to three different sessions. Technique sets one, technique sets two are specifically targeted to elicit dysfunctional thoughts or automatic thoughts, core beliefs, and so on. Right. And then eligibility that we prefer postgraduate students, right, which through I'm not restricting, but the preference who you can take up is this postgraduate students, and then those who have immediately done with their post graduation and then looking for job, right? And then for professionals who would want to skill up themselves and then need a professional supervision, can take can get useful with this course. Yes, I'm done with it. It will be on online, Nila Romana. Any other questions that you guys have? When will this training be held, sir? And it is an online forum. Yes, Elizabeth. It will be in an online forum. We'll be soon launching it in the month of November. We're working on the operations. Yes. Any other doubts, questions? No? Okay. Yes, fees. We are working on the fees. I'm not. We are not very certain about the fees. Yes. I roughly think it will be around 12 to 15,000. That's what I'm roughly mentioning. And then we are again restricting the intake to 10 participants per batch, not more than that. Maybe we may extend to 12, but definitely not more than 10 to 12. Because we really, as I mentioned earlier, we really wanted to be as committed as possible. And then at every batch, we want to make 10 or 12 professionals, real professionals in CPT. So that's what the intention. If you have any other queries, you can talk. Otherwise, and then we have upcoming workshops also for the next 3 weeks. And I request all the participants to make useful of the other workshops as well. Right? Okay. So thank you so much for your active participation, then for your patience. Yes. Thank you all.
Any questions?
No questions, we can wind up. Yes.
Okay, thank you so much, participants, for your active participation. You'll receive the certificates within 5 working days to your registered mail ID. So, once again, thank you so much. We look forward to seeing you as part of our future workshops. Thank you.
Thank you. Yes, Shrika Nair. Thank you. Thank you all.